Welcome to our first practice. I'm Johnny, and today we're going to walk through clearing the big six. These are the first 6 major restriction points in our deep lymphatic channels, and it really doesn't matter if you're an athlete trying to recover faster or you're dealing with chronic pain and inflammation. We're pretty much always going to start with the big six. Typically, I'd probably recommend that you use a vibration ball for this practice, but you may not have one and you might not even be ready for one yet. So today we're going to do our work by hand. And when we do that, we're going to start with just a gentle touch before we start to massage in a little bit deeper. Now we're going to leave each area with some strikes, probably about 5 to 10 times, and then we'll move on to the next spot. Now with our lymphatics, we're always going to include breath work. So today we're going to be breathing in and out through the nose. We're going to pause at the top and the bottom of each breath, and we're going to make sure that our exhales are a bit longer than our inhales. Now we're also going to include some manual vagus nerve stimulation, and today we're going to use what I call the ocular reset. We're just going to take the heel of our hands, place them gently over our eye sockets, and we're going to follow our breath. Now we're just going to need a comfortable place to lay down. So if you're ready to get started, let's go ahead and we'll get going. All right, I'm just going to have you lay down on your back. You can make yourself comfortable. And we'll rest our hands over our abdomen. Now, before we get started, there's a few things I want to mention. The first one is that order makes a huge difference on how effective our practices will be. And what we do today is going to give you the roadmap for what we're going to do in our future practices. Now, most people are going to notice a significant difference. They're going to feel better after what we do right now. However, it is possible to have a detoxing effect. So if you feel nauseous or lightheaded at any point, you can stop, you can continue your breath work until things kind of calm down. It just means we'll have to go a bit slower with our practices. Now we're going to start by going into our breath. We're going to breathe in and out through our nose. We're going to find a subtle pause at the top and the bottom of our breath. And we're going to make sure that our exhales are about twice as long as our inhales. Now as we breathe in slowly, I want to feel for pressure building into my lower back and into the sides of my body. We'll pause at the top of our breath, and then as we exhale, we'll slowly allow tension to release from our body as if we're sinking into the floor. Again, we want to feel that pressure build into the lower back as if the lower back is pressing against the floor as we inhale. And as we exhale, we'll feel our lower back gently raised up away from the floor. We'll bring our attention to that pause at the top and the bottom of each breath. We can use that moment to observe how our body feels. And with each breath, our exhale can become a bit slower than the last. And at the bottom of our next exhale, as we pause, we'll bring our hands over our eyes, using the heel of our hand to place a light pressure over our eye socket. We'll continue to breathe slowly in and out through the nose, finding our pause at the top and the bottom of each breath. Again, we'll bring our attention to feeling that expanding into our lower back as we inhale. And as we exhale slowly, we allow tension to release from our body. Try to make your exhales as long as possible without feeling like you're running out of breath. And with our next slow exhale again, we can rest our hands over our abdomen. As we exhale slowly, we can feel tension release from our feet and our legs, our hips and our lower back, our chest and shoulders, our neck, and our face. And with a slow exhale, we'll bring our right hand just below our left collarbone, starting at the sternum. And with a soft touch, we'll begin working our way out towards the shoulder. Gradually, we can begin to push in a little bit deeper. We can do both clockwise as well as counterclockwise circles, but remember, the nervous system always responds best to different. So whatever we do today, we may do it different tomorrow, and that's okay. We're going to bring our attention back to our breath, finding that pause at the top and the bottom. We're going to make sure that our exhales are longer than our inhale. You can work back and forth from the sternum out to the shoulder several times. But if we're following our slow breath, our hand will generally move fairly slowly as well. You can imagine that you're pulling the skin and the tissues away from your collarbone down towards your chest. And then before we move to our right collarbone, we'll leave with our strikes. So we'll strike maybe 5 to 10 times. And again, let's rest both of our hands. As you breathe slow, just notice the difference between the left side and the right side of your body. Perhaps your left shoulder, maybe your neck feel a little bit more relaxed on the left side. We'll always bring our attention back to our breath, breathing the air in slowly through the nose, finding that pause before exhaling slowly. And then as we pause at the bottom of our next exhale, we'll bring our left hand to our right collarbone. Again, we start below the collarbone, right near the sternum. As we work out to the shoulder, we'll use a soft touch before we start to work in a bit deeper. I'll remind you again to follow your breath. Try to use that pause at the top of your inhale and the bottom of your exhale as an observation point. Just be aware of how your body feels, allowing the tension to release from our body with each exhale. We'll finish with our strikes 5 to 10 times. Then we'll rest our hands. We'll bring our attention back to our breath. When we inhale, we build pressure into our lower back and into our abdomen. It's going to help create circulation in the lymphatics. It's also going to stimulate the vagus nerve. So I want you to really focus in on your breath, feeling that expanding into the lower back and into the sides of the body as we inhale. Pause at the top of your breath, and then exhale very slowly. From here, we're going to bring both hands to our neck. We're going to work the SCM muscles from above the collarbones up underneath the ear. We'll continue to follow our breath. We want to pull everything down from below the ears back to our collarbones. And then as we finish with our neck, we'll leave with some gentle strikes. Just going to use one hand at a time. And then again, let's take a moment to rest our hands. We want to go deep into our breath, really feeling that expanding into the lower back as we inhale. As we pause at the top and the bottom of our breath, just take note of how your body feels. You can relax your shoulders, your neck, and your face. Always bring your attention back to your breath, bringing the air in and out through our nose, finding that pause at the top and the bottom of our breath. And with an exhale, we'll bring our right hand to our left shoulder. We're going to work where the pec muscle attaches into the shoulder. Again, I start light before we start to work in a bit deeper. We'll always bring our attention back to our breath. Then we're going to slowly start to move into our armpit. Use our hand to pull the pec tissue, the breast tissue out of the way as we use our fingertips to work in between each of our ribs. We're slowly going to work down the side of our body, all the way down to the lowest rib. Here you can imagine using your fingers as like a rake to get in between each of the ribs on the way down. And you can work your way down and back up again. And then we'll finish with our strikes all along the side of the rib cage as well as the chest. Then again, we can rest our hands wherever you find them to be comfortable. As we breathe again, I'll ask you to find that pause at the top and the bottom of your breath. Feel that expanding into the lower back each time you inhale, and allow your body to relax as we exhale slowly. We'll bring our left hand to our right shoulder. We work in soft before digging in a bit deeper. We'll follow our breath as we start to move into our armpit and along the side of the ribs. Try to feel that expanding into your lower back so that your lower back presses down as we inhale. As we exhale, we allow tension to leave the body. Then we'll finish with some strikes along the rib cage and the chest on the right side of the body. Then we'll rest our hands. We'll fall back into our breath. Use the pause at the top of your inhale and the bottom of your exhale to observe how your body feels, what has changed since we started. We'll always bring our attention back to our breath, finding that expanding into our lower back. From here, we're going to move to our sternum. We're going to use our fingers to work between each rib where they connect in to the sternum. So I'm going to start just below my collarbone, between the collarbone and the first rib. Then we'll move between ribs 1 and 2. And we're really trying to feel right up to the sides of the sternum. We'll move down between ribs 2 and 3. I'll remind you to go back into your breath if you've forgotten. And then just slowly we're working between each and every rib. On the way down to the xiphoid process, which is at the very bottom of your sternum. And then we can do a few strikes on our sternum. I'm going to rest my hands on my abdomen for a moment. Always returning to our breath. From here, we're going to use our hands to work down the center of our abdomen as if we're splitting the rectus abdominis, the six-pack muscles, down the middle. As we work in, I want you to exhale fully. Allow your hands to sink a bit deeper into the abdomen. And when we get about 2 to 3 inches above our belly button, this is where the sternochyli sits, back there on your spine. We do not have to push all the way into the spine to influence it. But when you exhale, we can push in as deep as you can comfortably. Now, as we work our way down, we're going to stop at the 12 o'clock position on the rim of the belly button. So just above the belly button, we're going to make 10 clockwise, followed by 10 counterclockwise circles. And again, this is right on the rim of the belly button at the 12 o'clock position. And then we're going to move to the 3 o'clock position. So just off to the left side on the rim of the belly button, 10 clockwise and 10 counterclockwise. Then we move to the 6 o'clock position below the belly button. Same thing, 10 counterclockwise, 10 clockwise. And now to the 9 o'clock position to the right of our belly button. Both counterclockwise as well as clockwise. And then from here, we'll rest our hands again. I'll remind you to follow your breath, bringing the air in and out through our nose. Find that pause at the top and the bottom of our breath, and we'll allow tension to release from our body as we exhale. Use that pause at the top and the bottom of your breath to kind of feel the stillness of your body. Then we're going to move to our groin creases where our femur comes into our pelvis. We can use both hands at the same time. We continue to follow our breath as we work in. From here, we'll go into our strikes. We'll do again both sides at the same time. We'll rest our hands again. We're going to move now into the inner groin. We'll bring our right leg out to the side. There is a strap of tendons that connect your inner thigh, your adductors into the pelvis. We're going to find that strap and hook our hands underneath. And we'll start to pull up into the groin. And I kind of do it as a pumping action. So I'll pull up and release maybe 5 to 10 times. Do the same thing on our left side. Then again, we'll rest our hands over our abdomen. We'll follow our slow breath, bringing the air in and out through our nose, pausing at the top and the bottom of our breath. As we exhale, we allow tension to leave our feet, our legs, our hips, and our lower back, our chest, our shoulders, our neck, and our face. At the bottom of our next exhale, we'll hold our breath for as long as we can comfortably. Then as we need to breathe in again, we'll bring that air in through our nose. We'll hold our breath again for an extended period at the top of our breath. As we fall back into our breath, I'll encourage you to continue to follow your breathing, letting go of any resistance, allowing tension to release from our body. Continuing to make our exhales slower and longer than our inhale. As the video plays out, I hope you enjoyed this practice, and I'm looking forward to seeing you in video 2.